The British Society of Periodontology and Implant Dentistry has recently published evidence-based guidelines on the management of periodontitis. The idea of the guideline is to help improve the quality of the perio treatment we can offer our patients. We've also produced a flowchart with 4 easy steps to help support you in implementing these new guidelines in practice. We've asked key opinion leaders their views on these guidelines, and we'd really like to engage you. We know you can make a difference. We want to improve the UK's oral health.
Globally, we see about 50% of the adult population having some form of periodontal disease, irreversible periodontal disease destruction, and we have about 11% of the population who will exhibit severe periodontitis. Those figures are fairly uniform across the world. When I read the guidelines, my initial thoughts were that it was great to have all of the frequently asked questions and their answers all in one place. It's a really great reference tool to go and get evidence-based answers to all the frequently asked questions. Without doubt, all oral health care professionals should be using this guideline in their practice because it provides an evidence-based and logical flow for the management of periodontitis.
I think one of the best things about the new S3 guidelines is the way it breaks down our treatment approach into different stages or phases. And really this is something that we've been doing in our approach, but not so systematically, and now that's allowing that translation into a systematic approach where we understand that phase 1, what are we concentrating on, what is our focus, what is our goal, and then phase 2, moving on to treatment. And then really for general dental practitioners, we are really then concerned with, say, phase 4 and how we're maintaining that patient and how we allowing stability of disease, maintaining them to be stable in the long term. And if they do then develop recurrent disease, how do we then go back into that cycle and manage the disease going forward?
The data in the S3 guidelines is very robust. This has been a meeting of European experts in periodontology who have gone off and looked at the evidence base and produced systematic reviews to answer the questions posed in the S3 guidelines.
It's not now, can it be implemented? It must be implemented. We now have evidence now to show us how we should manage our patients in the best manner possible. That's evidence-based practice. We have the leading academics and specialists who have sat down, looked at all the evidence around all the different aspects of managing periodontal disease, stages 1 to 3. And that's the majority of the work that we do in general dental practice. As an NHS dental practitioner, stages 1 to 3 periodontitis is a large volume of my workload. And so this is really relevant for general dental practice. So it's a matter of not can you, but how will we?
Yes, I do think that this guideline can be implemented in both NHS and private practice. There are some limitations in some of our specialties, but the ability to structure a care pathway for the patient that includes the ability to monitor and then come back to continue the treatment means that the implementation alongside the Healthy Gums Do Matter program is actually really useful, and there's really no reason why it can't be implemented on NHS dentistry. In my role with the Office of the Chief Dental Officer, we support the implementation of the guidance, and also it allowed us to have an ability to recommend certain treatment pathways that was in line with our standard operating procedure, which we've put into place. And as we progress out of the pandemic situation, the transitional document will also make reference to the guidance.
I think the BSP S3 guidelines are really useful for dental therapy and hygiene undergraduate students. The reason why is because it's a continuation of what we're doing already. So we've been given the 2017 classification for periodontal diseases. So once we staged, grade, and identified risk factors for a patient, we now have the next step. So it gives us a formalized structure of treatment plan. As a dental student, when I read through the guidelines, my initial thought was, it's over 100 pages. This is going to be a nice long read. But it was actually really easy to follow, really intuitive, no complicated terminology. And the best thing about all of it was it has a flowchart at the end, which summarizes the 100 pages. And I think that's the key for anything, for a student especially. That's what we want to have. I think the S3 guidelines will influence my perio education as an undergraduate student in a positive way. We're normally asked to get lots of information before we do anything, and this document has a wealth of information behind it, supporting evidence for each step. So it's a really good source of revision.
I think that the whole dental team should be involved in the implementation of the S3 guidelines, because management of periodontitis in practice is not just done by one individual. We really must take a team approach to periodontal care, and this S3 guidance is applicable to dentists, hygienists, therapists, and even dental nurses if they have the oral health educator qualification, to educate patients to take responsibility for their disease.
The ability to motivate and educate patients is not just down to the dentists. Dental therapists, dental hygienists, and dental nurses have a critical role. And I think that if you can place the education in front of them, then the guidance can be used to motivate both the team and then eventually the patient in the chair.
And so patients are not only dependent upon the dental team, but they can take self-ownership and actually read about periodontal disease, periodontal health, oral health, and be able to try and maintain and achieve good oral health. This is crucial actually, because actually the ultimate success of our treatment relies upon the patient taking ownership of their oral health. So for them to be able to increase their knowledge and understand the disease better and be able to manage it better, I think is a great way forward.
The guidelines have the potential to change patient quality of life in two ways. Firstly, in the professional management of periodontal disease, this document will allow clinicians to access the most up-to-date, evidence-based treatment strategies for the management of the disease. Secondly, it will also empower patients to take some responsibility for their disease and seek out evidence-based treatment protocols for the management of their disease. Whilst the S3 guidelines can look a little bit daunting when you first read them, just through the sheer volume of information that's there, very helpfully within the documents there are summary sections that basically show you the evidence-based answer and recommendations to the various questions.
One of the things that I really like about the BSP is they are able to produce evidence-based guidelines, but make that practical and simple for us to follow as general dental practitioners, hygienists, therapists.
So the BSP have produced a flowchart to help make the recommendations and guidelines more digestible. There's a QR code on the corner of the chart, and if you scan that, videos will pop up to help guide you through the flowchart. And it breaks it down into manageable sort of chunks of the stages, the main stages that are there in managing periodontitis.
This is a wealth of information, and for those people who want to read the full 130-page document, then it's there. But for those people who want to take away the main messages, then there are simplified flowcharts and documents there to be able to translate that and make that easier to deliver and in practice.
The BSP have also produced a flowchart written in lay terms, which is designed for your patients and can be given to them maybe once they've had a diagnosis of periodontitis. There's a huge body of evidence that shows that patients who regularly take part in supportive periodontal care are far more likely to remain periodontally stable, and it reduces the risk of tooth loss.
Early intervention with regards to gum health is absolutely essential. The sooner we intervene in early periodontal disease, even if that is just gingivitis, the easier it is for us to manage and the less damage is done to the patient. So early intervention is absolutely crucial, and we shouldn't let a disease become too established before considering an intervention. One of the things that I particularly liked about the S3 guidelines was the concept of this staged approach to periodontal care. Stage 1 being patients taking ownership of their disease, improving their oral hygiene and managing their risk factors. For a long time in periodontal management, dentists have focused on the treatment of disease rather than the prevention of it. By empowering the patients to understand the causes of periodontal disease, hopefully we can reduce the burden of disease in this country.
And if we are able to get our patients to health or periodontal health and stability quicker, then that ultimately the economic burden will reduce, not only in private practice in the NHS, but also for our patients. Moving forward, the cost of treatment is inevitably more expensive than to prevent treatment. If we are preventing disease and maintaining health, this will help to reduce the economic burden.
I think if you're struggling to take on board the vast information in the guideline, start, like I say, with the flowchart, get to grips with the flowchart, maybe organise a lunch and learn or a study group within your working environment, and then use that, use the steps to break down the reading into smaller stages and ask questions. Everyone's passionate within, healthcare, and there's always someone who's willing to explain things to you if you're having trouble getting to grips with it.
One of the top tips that I have is to really focus on stage 1, phase 1 of this document, and really that lies at the heart of how we're trying to manage our patients. What are we asking our patients to do, and what do they need to achieve? What do they need to be able to do to achieve periodontal health and plaque control? And ultimately, the outcome of our treatment is reliant upon the patient's behaviour and them changing their behaviour and engaging with the process. If they take ownership of their oral health and their plaque control and daily oral care, then we will get successful outcomes.
In addition, the BSP are putting together a series of 4 free webinars aimed at the whole profession, led by some of the UK's leading periodontists, to explain the 4 stages of the S3 guidelines.
The BSP want to realise their vision, periodontal health for a better life. And with your help, we think we can do that. I would like to thank GSK for bringing our flowchart to life. I would like to thank the BSP. They've done an amazing job. And most of all, I'd like to thank you for your support. We'd like to hear your views, and we'd like to share them with our friends and colleagues. You can make a difference. Together, we can improve the health of the UK.